The internet is not just for holiday shopping this winter season. Living in the age of information, these days it is easier to get more information online. Although we need to be careful and ensure that the information we receive is reliable, this has changed the relationship between BPH patients and urologists. BPH, or benign prostatic hyperplasia, is a condition in older men where the prostate enlarges and may cause lower urinary tract symptoms LUTS. The argument goes like so. Patients who self-research treatment options for diagnoses for their doctor go to their doctor with their findings, but doctors might not always be informed or open to this research, not to mention these studies may not always be accurate. This is especially the case for supplements and plant-based treatments found by patients. This can create tensions between patients and doctors. Up until now, doctors who went to medical school for many years to obtain their board license and practice on patients are expected to be the authority in their field. Because they took the Hippocratic Oath, they are also expected to put the patient first. Although this dynamic of authority is not often questioned, as more patients begin to research treatments, more clashes have begun. Here are concerns from the patient's side. My doctor just wants to prescribe meds and surgery because they're sponsored by big pharma and medical device industries. The doctor is too busy with patients to be up to date on research for my condition. Thanks to my extensive research and work with my support group, I know more about my own condition than the doctor. Here are concerns from the doctor's side. My patient thinks this supplement will work, but supplements are not regulated enough, and I don't want to be held liable for recommending a potentially useless treatment to my patient. Because of insurance costs and such, my practice needs financial support to stay open for my patients, so pharma may approach me to promote their products, but it is up to me to decide if these treatments are appropriate to prescribe, so I must take ethical caution when receiving sponsorship. Unfortunately, there are cases where doctors may not be well informed of difficult-to-treat conditions, and their bedside manner and attitude towards their patients may not always be in their best interest, but this isn't to say the doctor is always the bad guy, nor is the patient always right. Here are some solutions to alleviate tensions. 1. Ensure that your medical research is reliable. X has had clinical trial data. 2. Get second opinions from other physicians and urologists whenever possible, and if your relationship with your doctor is not the best, consider changing doctors. 3. Talk to support groups on their findings and thoughts. 4. When approaching doctors with your findings, be respectful and civil, and we can only expect doctors to return the same civility when they give their feedback. For example, although plant-based therapy is not as openly recommended by the Western medicine world as treatment used traditionally by our ancestors and currently in Asian countries, traditional Chinese medicine, research can still be encouraged by the public so that medical entities can find new solutions to problems like BPH. There will be skeptical patients who doubt and question the motivations of doctors, and there will be doctors who are concerned whether patients have found substantial evidence of treatment, but with support and information at hand, we can continue to shift the landscape of men's health.